Good morning. Today's video is about communication in this exam. So we have two communication stations in this exam. One of them is speaking to your senior to update them or refer a patient or ask the advice in managing a patient. And the other one is communication to patient or patient relative. Okay. So before entering this communication station, there is separate preparatory station. So you're going to go through the patient file or the patient case notes, okay? So you need to read them carefully to understand uh, what this about, okay? So they have information about the patient identifications, patient history, examination findings, any imagings, any bloods. So everything is going to be there in the patient case notes. So you have to read them carefully and make your own notes. Okay, so just quickly make your own notes. For the examination phone call, so when you are going to call your consultant or your senior, you're going to have copy of that file, patient notes, patient case notes file. Okay, so you're going to have it in the next station, and you are allowed to go back and look if there's any information you want to check and say to your senior. You can go back and check that information. For the communication person, actually, guys, is not about memorizing what you have already from your notes. Okay, very important, these things. I've noticed many candidates doing that. So memorizing what's in the notes is not going to score you good in this station. Very important to simulate a real life situation and consider this patient is a real patient at your clinic and deal with them accordingly. So you are not going to memorize. That's going to cost you a lot. That's going to cost you a lot, guys. Okay. So just simulate this real patient at your clinic and speak to them according to that. Okay. So there'll be most likely the same scenarios, the same questions, but how you're going to respond to them. Are you listening to this patient? Um, do you did you let the patient to guide you? Yeah, to did you ask about what the patient understanding about this situation or about this condition? So these are very important things, and you are going to start accordingly. So some patients are angry, some patients are anxious, and some patients are very calm, just as in real life. In real life, you have angry patients, you have calm patients, you have anxious patients. You're going to face every different type of patient, right? So, same thing applied to your exam, okay? And one of the things I've noticed when the patient ask the candidate a specific question, they'll try not to answer directly. Why you are not answering that question directly? This is your patient. This is your patient. And I think that's not nice actually. So you're trying to be nice to your patient in breaking news. There's a way to break the bad news for the patient. Actually, there's a way, and you have to learn it. So yeah, there's a way, and you have to practice it. So by like just not giving them the answer, like escaping from the answer, if they are angry, it's going to make them more angry. Actually, it's going to make them more angry, and you're going to make this exam very, very stressful, and this station is specifically very stressful. Notice many candidates complain about these patients: angry patient, angry patient, angry patient. Actually, you have a big role to make this patient angry or not. It's very important how to calm your patient down, answer their questions directly. Okay, so without hesitation, that's going to calm them down. Communicate appropriately, that's going to calm them down. Okay, understand the situation, listen to them carefully, and always remember listening is clinical skill, guys. And let your patient guide you in this exam, in this communication, specifically in this communication person. Let the patient guide you. Okay, so very, very important, very important. And always remember listening is clinical skill, and you have 2 ears and one mouth. Okay, so remember that, always remember that. And one important thing you need to understand how the communication marks, how the communication stations are marked. So understanding this is going to change a lot of things. The communication stations marked as 4 marks for your knowledge, for clinical knowledge. Yeah, and I think you'll be surprised by this. 4 marks for your clinical knowledge and 16 marks for your communication and professionalism. In general, guys, communication is 25% of this exam. In your history, you have communication marks. In examination, you have communication marks. Even in the knowledge part, we call it critical care or CRISP stations, you have communication marks as well. So communication in this exam is very, very important. And to pass this exam, you have to communicate well with your patient. Thank you. Thank you so much. I'll see you next time. Bye.